But first, we have to begin with coronavirus. This story took an enormous turn this week. San Diego's cases continue to tick up. Sporting events are canceled. People are stocking up on groceries. And at this point, all eyes are on our county, our public health system, and our elected officials. Well, I have with me one of the leaders in the local battle against coronavirus, County Supervisor Nathan Fletcher. Thank you so much for being with me.
Yeah, thank you for having me.
First off, how are you feeling? Have you been able to stay healthy?
Well, no, we've been able to stay healthy, and that really is one of the important parts. Is coronavirus presents a real concern and a real threat. We take it seriously, but it also presents an opportunity for each and every San Diegan. There are things that we can all do within our control. When we talk about things like wash your hands, that's actually a step that we each take. Keeping distance, getting a flu shot, stay home if you're sick. And in particular, our call this week around vulnerable populations. If you are over the age of 65, we are asking you to cancel all non-essential travel, to avoid any mass gatherings, really to get comfortable being at home if you have chronic illness. And if we come together, we're going to do everything we can as a county, and we are. And we're going to do everything we can as a state, and we are. We're going to do everything we can working together with our health systems and our partners and putting in place more testing and better protocols and getting people care and standing up dedicated rooms and having outreach for homeless and hand washing stations. But this is one where we're going to all come together. And I've been really encouraged by the community really coming together to support the collective impact this can have on all of us.
All right, Supervisor, let's tackle a few of the things you just mentioned there. I think the main question we have and will have going forward is our county prepared for more coronavirus cases?
Well, we are prepared. And we started talking about this in January. The first time we did a public announcement of this was January. In February, we were one of the very first local jurisdictions to declare a public health emergency, a state of emergency. We've been doing daily calls with our entire County Emergency Operations Center, with CDC, with our hospital partners, with the military, with everyone. But the reality is, and we've said this from the beginning, this is going to get worse before it gets better. There are global trends that the coronavirus has a unique high rate of contagion, and because we have no vaccine, the ability for it to spread is greater. Now, as that happens, we are doing everything possible to prepare for it, to go for it. And I really think, Danny, I think it's important too for folks to understand a lot of what we're doing is designed to what we call flatten the curve. Right. So as you've seen jurisdictions, whether it be China, Italy, Seattle, that have not been prepared, that have not been aggressive, you see a huge spike in the number of cases. Now, for generally healthy folks, right, for you and I, we'll probably be okay if we get it, but we spread it to vulnerable populations, right, the elderly, those with underlying chronic conditions. And what happens is when that curve spikes, we overwhelm the capacity of our local hospital system. We only have so many urgent care beds. We only have so many ventilators. Now, we're trying to stand up more. We're working to expand capacity. But as we do social distancing, as we ban mass gatherings, as schools begin to close, as we ask people, what we are doing is lowering and slowing that infection rate to a point where the people who need the emergency care, that it is available for them.
Supervisor, we keep hearing on the national level this conversation about testing, and obviously something that you guys speak about as well. County Public Health said this past week that they're talking with other cities about testing methods. I heard things like drive-through testing, but they also say they can't test everyone. Right. Is that acceptable to you, and are you confident that we will have enough testing as we get more cases?
Well, I would like to be able to test everyone. I would like for us to be able to test everyone out there. The reality is there is a limited capacity of testing, and we are fighting to get every single possible test we can get for the County of San Diego. We are fighting to get more from CDC. We are fighting to get more components for our own testing capacity. We've authorized action to buy any that are commercially available. We're working with local hospitals. We're working with the state. We are doing everything we can to get as much testing capacity as we can in San Diego County, and we will continue to do so. And I think that situation will continue to improve, but it's not for lack of want. It is a global crisis, and there's a global shortage, and so we're doing everything we can. I do think it's important for the public to understand, though, if we have limited testing capacity, we have to prioritize that testing capacity. So if you feel like you might have it, but you haven't been in contact with anyone who has it, you haven't traveled anywhere who has it, and a doctor who's been in contact with someone feels like they have it, that doctor is going to get tested before you do. Because if they're negative, I can get them back in providing life-saving care.
There will be triage, if you will.
That senior citizen who lives in an assisted living center, if they have symptoms, we have to test them first. Because if they're positive, we got to immediately make sure that they don't return to that environment. if you have a chronic respiratory illness. And so we do have to prioritize the testing for the folks who are most vulnerable and most likely to have it. But we're fighting every day for new methods, whether they be drive-through, whether they be home testing, and we're fighting every day to get more tests. So I know it's on the minds of the public. It's on my mind. I ask about it. I think about it. I push on it every day, and we will keep pushing.
Last thing, Supervisor, you're a father. I'm curious your perspective. What would you say as schools are closing? What would you say to concerned parents out there who are trying to make sense of this issue?
Well, this is something that is definitely disruptive to everyone's life. We know that where we're banning mass gatherings, and now we see schools beginning to close. What I would say to every parent out there, and something that we talk about every morning with our kids, is that look, this is real, and this is going to have an impact, and more people are going to get sick, and we're going to lose some folks. But you know what? We're going to get through this. We're going to be okay. We're going to come together. People are going to wash the crap out of their hands. We're going to do appropriate social distancing. We're going to slow down for a little bit. But we do come together. And I think San Diegans should be really pleased. This week we stood, and in San Diego, this is not a partisan issue. This is not a jurisdictional issue. No one is pointing a finger. Cities are working with the county. Counties are working with the state. States working with the feds. Our local hospitals are stepping up. People are volunteering. They're donating time. We're seeing expansion. We're seeing great care for our homeless and unsheltered. And as a region, we are going to get through this. And it's going to be difficult, and it's going to be hard, and it's going to be disruptive. But we need everyone's cooperation. We need everyone's patience. We need everyone's help. And in particular, we need everyone's compassion for those individuals who are most vulnerable, in particular our seniors, our unsheltered, and those folks. And so I think the message to San Diegans is remain calm, remain vigilant, but know that, hey, we are going to get through this.
Supervisor Fletcher, thank you so much. I'm sure we'll be checking in with you more as this develops.
Thank you, Dan.